Hey everyone, welcome back to Nova Pain and Rehab Center again. So today I want to talk about a couple simple stretches that you can do at home if you have or have experienced an acute back condition. Now these are very simple. They require no equipment, and I just want to go through them with you because a lot of the times in the beginning, if you do experience an acute back problem and you can address it immediately, it may offset some of the long-term results that we often see with people with other type of back conditions. Okay, so let's get into it. So the first movement I want to do today is called the Camel. So the starting position for this movement is going to be on hands and knees, neutral back position. Now there's two different movements we're going to do with this. The first one, we're going to go into the cat position, tuck the chin down, push the shoulder blades up to the ceiling, and tuck the hips forward. We're trying to expand and stretch this area of your back through here to decompress the discs and the joints of the lower back. Second position is relax, head goes up to the front, get the divot through here, hips come up, pushing the belly down. Okay, let's do that again. Each one of these positions should be held for about 3 to 5 seconds. And you're really trying to get the maximum movement with that endpoint position. One more time. Okay, and see how the back comes up and down. Now with any of these movements we go through today, if you experience any pain with any of these movements, either check yourself or back off a little bit and see where your endpoint range of motion is. Second movement we're going to do is called a bridge. So we lay on the back, okay, knees come up. First position is take the hips straight up towards the ceiling, pushing up. Now with this position, you want to push your hips up, okay? Contract your glute muscles, your butt muscles. Again, hold this position for about 3 to 5 seconds. Slowly come down to the floor. Push your belly button down to the floor. Now with this part, you want to flatten your back out. Okay, relax. And then slowly come back up. Pushing the hips all the way up to the ceiling, getting that full extension through the hips. 3 to 5 seconds, and then come on back down, slowly come down, press the belly button to the floor, flatten the back out. Again, trying to open up the joints to the back and decompress the discs. Okay, so let's go through the last position. It's going to flip you over. We're going to go face down in this position, all the way down to the elbows. And this is called a Cobra position, or rehab we call it a prone press up. Again, this is used for an acute back condition that mostly deals with a sciatic or disc condition. And what we're trying to do here is to re-centralize the disc to take pressure off of the sciatic nerve. Okay, so we're going to go through a couple different positions with this. Let's go to the first position, just up to the elbows. Now this is as far as you can go before your back starts to hurt. This is as far as we're going to go with this one. If you can go here and you still feel pretty good, we're going up to the second position, up to full elbows. Again, pressure in the back through here. If you start to have pain, you want to make sure that that's as far as you go. Let's go to the third position. Okay, now we're starting to push up with the hands. And with this position where you see more of an arch in the back through here. Okay, and then if you're really feeling good, you can go all the way up. Let the hips float. I'm going to float the hips back and forth a little bit. Get a full extension to the back. And this is the fourth position of the Cobra, or the prone press. Okay, so thank you. Again, these are conditions you can do if you have an acute back condition. Thanks for coming out today. Have a great day. Boom.